Assalamualaikum and hi. My name is Siti binti Johar. My number matric is 280544. I will start with introduction. A variety of diseases that damage the heart are referred to as heart disease. The terms heart disease and cardiovascular disease are sometimes used interchangeably. These terms used to describe disorder in which blood pathways are weakened or blocked, which may result in a heart attack, chest pain, angina, or stroke, such as those that affect the muscle, valves, or rhythm of the heart are often classified as heart disease. In this research, the sample survey is conducted to get know about the several contributory risk factors such as diabetes, high blood pressure, high cholesterol, abnormal pulse rate, and many other factors among the patients. Next, the objective of study is first to identify the heart disease from several risk factors such as diabetes, high blood pressure, high cholesterol, abnormal pulse rate, and many other factors. Second, to interpret and find the relationship between the variable data from a large quantity of data. Third, to assist in making decisions and predictions from the large quantity of data produced by the healthcare industry.
Okay, next, for the data collection, we use data set 4, which is heart disease patient data that is given by Mr. Aris, our lecturer in the elementary statistics. And then for this data collection, we use descriptive research that is describe a phenomenon and its characteristic, especially about heart disease data. And then this research also can record the human behavior, object and situation without asking the respondent. And then this data also is the quantitative data. Quantitative data is the collection technique based on the social media monitoring.
So, I will continue with the method of data analysis. This study involved 150 patients and this study is based on derived data. The data that we got are the patient's age, sex, chest pain type, resting blood pressure, serum cholesterol, fasting blood sugar, resting electrocardiography results, maximum heart rate achieved, exercise-induced angina, ST depression induced by exercise relative to rest, the slope of the peak exercise ST segment, number of major vessels, person's memory, and diagnosis of heart disease. As you can see, this is the table for the skill measurement.
Okay, data 1 is the analysis of age. Okay, we can see the pie chart of the patient age. Figure 3.1.1 shows the range of the heart disease patient. Okay, from the pie chart, we can get the most frequency from the chart is 63 patient and its modal class is 50 to 59. That means the most of patients that were suffering from heart disease were around 50 years old and to 59 years old, which is 63 patients out of 150 patients.
Next, data 5, analysis of resting electrocardiography. They have three results from the test, which are normal, STT wave abnormality, and left ventricular hypertrophy. From the chart, the most frequency is having left ventricular hypertrophy, which is 56%, and it's 84 samples from 150 samples.
Next is the bar chart of the maximum heart rate achieved by the patients. So from this bar chart, we can see most of the patients achieve 150 to 179 beats per minute of the maximum heart rate achieved, with the mode of 78 patients followed by 120 to 149 beats per minute maximum heart rate achieved with 47 patients. Instead of that, the lowest frequency of maximum heart rate achieved is 180 to 209 beats per minute with 12 patients only, and the second low frequency is 19 to 119 beats per minute maximum heart rate achieved by 13.
Assalamualaikum warahmatullahi wabarakatuh. My name is Fatin atiqah binti nasron and my matric number is 280158. I would like to explain about data 14, which is diagnosis of heart disease. From the data, the highest frequency of cases is 83, recorded in age between 80 to 19 years old. And the lowest number of people that have a diagnosis of heart disease is only 7 people in between 10 to 20 years old out of a total of 150 people. So, for the conclusion, we can conclude that aging can cause changes in the heart and blood vessel that may increase a person's risk of developing heart disease. The type of chest pain show that asymptomatic is silent because the symptoms lack the intensity of a classic heart attack. It shows the typical angina means the symptoms they have include chest, arm or jaw pain described as dull, heavy, tight or crushing. Overall, based on the analysis above, we can conclude that we need to do more research like this because this research can give awareness to the public about heart disease. People should know patients of heart disease are coming from all various ages and gender. Instead of that, people should be aware of the types and symptoms of heart disease so they can prevent it before it gets worse.